The era of COVID-19 in terms of the pandemic has provided some new challenges for neurologists treating multiple sclerosis. When initiating therapy for the first time, we focus on efficacy, safety, and tolerability. In the era of COVID, safety has taken forefront. That being said, I look for, well, obviously safety combined with efficacy, but also ease of administration in order to ensure or optimize patient safety. Switching therapies can often be a challenge, more so in the COVID era with restricted office visits, as well as restricted access to certain facilities for testing. Nonetheless, if a patient is experiencing breakthrough disease, I believe that strong consideration should be given to switching. With my established patients, I will typically bring them in for an office visit, or in this COVID era, sometimes do a virtual visit, explain the reasons for switching, outline my suggested options in terms of which drugs are to be considered, explain to the patients the profile of each of those drugs, and work with them really to decide which may work best for them. I've been fortunate in that I've not let me rephrase that. I've been fortunate in that none of my MS population has experienced COVID with serious complications. I have had several patients who tested COVID positive. They had mild to moderate degree of illness and recovered fully. As far as I'm aware, in terms of COVID era and guidelines for DMT monitoring, as far as I'm aware, I don't believe the actual guidelines have changed. Certain testing should be done either before initiating a drug or while a patient is on a drug. In terms of monitoring and guidelines with DMT treatment during this COVID pandemic, I guess one could say that access to laboratory testing and MRI facilities, for example, may be a little more difficult. So that may play a role in some cases in terms of choosing which therapy.